Let's talk about two of the biggest health challenges facing kids today: childhood obesity and cavities. Now, on the surface, you'd think they have nothing to do with each other, right? One's for the doctor's office, the other's for the dentist. But what if there's a hidden connection, a secret link between a child's weight and the health of their teeth? It's the big question researchers are starting to tackle. Is there really something that ties these two things together? Well, today we're going to dig into some really fascinating new research that might just hold the answer. But first, to really get why this question matters so much, you have to understand the sheer scale of what we're talking about. I mean, these aren't just minor issues. We're looking at two of the biggest public health crises for children all across the globe. Okay, get ready for this number. Worldwide, over 600 million children are dealing with untreated dental cavities. That is just a staggering figure, especially when you remember that cavities are largely preventable. They cause real pain and can mess with a child's ability to eat, to sleep, and even to learn in school. And at the very same time, we've got this parallel crisis of childhood obesity. It's gotten so serious that the World Health Organization has officially called it a global epidemic. The numbers have just exploded in recent decades, making it a major concern in pretty much every country you can think of. So, how do you even begin to unravel the connection between two problems this massive? Well, you've got to follow the data. And today, we're zeroing in on a really interesting study that came out of Damascus, Syria. Researchers there decided to investigate this very question in a pretty unique and challenging environment. So, here's the breakdown. The study looked at 462 school children, all between 6 and 9 years old. The researchers did two main things. First, they gave each kid a dental exam to check for cavities. Second, they measured their height and weight to figure out their body mass index, or BMI. Simple and straightforward. So, what did they find out? I want you to think of this next part like a detective story. The researchers started collecting clues, trying to hunt down the factors that were most connected to bad dental health in these kids. And the very first clue they found was a big one. A jaw-dropping 85.5% of the children in the study had at least one cavity. Yeah, you heard that right. A rate that high tells you that the root causes are running really deep in this community. So the detectives dug deeper and identified a few key culprits. It turns out kids with cavities were way more likely to come from low-income families, eat a lot of sugar, not eat many fruits and vegetables, and, you guessed it, not brush their teeth every day. No huge surprises there, but it confirms just how powerful these everyday habits and circumstances are. But this next stat, this is where it gets really stark. Socioeconomic status wasn't just a small factor, it was a massive one. Kids from low-income families had 19 times higher odds of having cavities compared to kids from high-income families. That's not a difference, that's a chasm. Okay, so we know all that, but what about our main question? What about the link between a child's weight and their teeth? After you account for all these other factors, is there still a connection? Let's take a look at the data. All right, have a look at this. This chart is pulled straight from the research paper. Each of those bars represents a different BMI group, from underweight on the left all the way to obese. The green part of each bar shows you the percentage of kids in that group who had cavities. Just watch what happens to the green as your eyes move from left to right. Here's the same data, but simplified, so the trend just pops right out at you. You can see a clear, steady, and pretty dramatic climb. The prevalence of cavities goes up right alongside BMI, peaking at an incredible 97% in the overweight group. The association is undeniable. The higher a child's BMI, the more likely they were to have cavities. So the link is definitely there. But this is the point where good science means we have to pause and be really careful. What does this connection actually mean? Does putting on weight somehow cause cavities? So, we have to talk about a crucial idea in science: the difference between correlation and causation. What this study found is a strong correlation. These two things are happening together. But it does not prove that a higher BMI is the direct cause of tooth decay. The real answer is a bit more complicated and, honestly, a lot more interesting. This table really tells the true story. The link isn't that one problem causes the other. It's that they share the same root causes, the same culprits. Take a look. A high sugar diet, well, that leads to more calories, impacting weight. And it produces the acid that causes cavities. Or look at low socioeconomic status. It can limit a family's access to healthy, affordable food and their access to dental care. You see, We're not looking at two separate problems. We're looking at two symptoms of the same underlying issues. And that brings us to the most important takeaway from this whole study. For parents, it means the fight isn't just about brushing teeth or portion sizes. And for policymakers, it means that separate programs for dental health and weight management just aren't going to be very efficient. To really make a difference, we need a holistic approach that tackles these shared risk factors together and thinks about the child's entire environment. So, in the end, this research leaves us with a real challenge. It's not just about individual choices, it's about the systems we all live in. It pushes us to ask a much bigger question. How can our schools, our neighborhoods, and our public policies all work together to make the healthy choice the easy choice for every single child, no matter where they come from or how much money their family has? Now that is the real question we need to figure out.